Hello, this is Montreal student 22, and today I am talking about the use of Clozaril, also known as Clozapine, which is the name of the molecule, in the treatment of TRS, treatment refractory schizophrenia. In my last video we saw how Abilify, aripiprazole, acted as a partial agonist on schizophrenia, and especially on the negative symptoms of schizophrenia. And I would like to add that Abilify can create a lot of akathisia, restlessness, which I didn't mention in my last video. Why am I talking about Clozapine today? Because it is the only drug used successfully in the treatment of TRS, or severe schizophrenia. Even though it was found in the meantime as typical antipsychotics, which by definition do not bind to serotonergic receptors, in the 50s, it is considered as an atypical antipsychotics because it actually binds to the serotonergic receptors. What makes Clozapine so different from any other antipsychotic? Well, there are different types of dopaminergic receptors in the brain: D1, D2, D3, D4, D5. Most antipsychotics bind to D2 receptors, mostly, and that's how it reduces the symptoms of schizophrenia. On the contrary, Clozapine is going to selectively bind to D4 receptors, and this is what is going to make it so effective in the treatment of schizophrenia. This is the only drug which binds more to D4 receptors than to any other types of dopaminergic receptors in the brain. So, the question is, why don't we use Clozapine to treat all schizophrenic patients? Well, the FDA only approved Clozapine for TRS, treatment refractory schizophrenia, and to reduce the rate of suicide in very severe schizophrenia. But why? Because there are quite frequent side effects that can lead to death, which is why it was withdrawn from the drug market and then reintroduced to the drug market only because of its effectiveness. The effectiveness of Clozapine is superior to any other antipsychotic, and it is clearly superior. Okay, so the first very disturbing side effect is agranulocytosis. It is a blood side effect, which is, to make it simple, a dramatic drop in blood cells, in a certain type of blood cells that can lead to death. This is why, well, it depends on the country, but in the first month of treatment there's a blood test every week, and then a blood test every 2 weeks for the rest of the treatment, or sometimes a blood test every month after 1 year of treatment. The second common side effect, okay, so I forgot to say something, 1% of patients taking Clozapine will develop agranulocytosis during the first few months of treatment if there's no monitoring. Of course, with monitoring, this risk decreases. Okay. The other very common side effect is myocarditis, which is a heart problem that can lead to death as well. The common reaction to hearing that there's a more effective drug out there for schizophrenic patients is I'm going to take it. But it is the wrong reaction because of the previous side effect I talked to you about, and also because of the very disturbing other side effects. I'm going to prove you wrong. Clozapine is very highly sedative, extremely highly sedative. Patients on 600 milligram or even 900 milligram, which is the maximum dose of clozapine, will be extremely sedated especially during the first few months of treatment. To give you an idea, if you have ever taken an antipsychotic, Risperdal is extremely mildly sedative compared to clozapine, and Zyprexa is only moderately sedative compared to clozapine. Okay. Other side effects are hypersalivation, for instance, which is very frequent and very disturbing. There's also a very high gain in appetite. You're gonna gain a lot of weight. It is not infrequent that some patients gain 50 pounds in a few months of treatment. So also, I wanted to say, because I forgot to say that, to mention it, but I'm going to say it. So of course, clozapine can cause tardive dyskinesia, TD, which is an often irreversible, very disturbing motor dysfunction resulting from the long-term or even short-term, well, long-term normally use of schizophrenia. Otherwise, we talk about acute dyskinesia, which is most of the time reversible. Anyway, FDA also approved clozapine because of its lack of extrapyramidal symptoms to treat schizophrenic patients who also suffer from Parkinson's disease and who suffer from TD, tardive dyskinesia. This is all for today. Once again, my final word will be talk to your psychiatrist about your treatment. This is the best thing to do. Thank you for watching.